Seizures are sudden, frightening, and often misunderstood events. In this video, I'll explain what seizures are, their types, phases, risk factors, triggers, and most importantly, nursing interventions and treatment, exactly the way you need for exams like NCLEX. A seizure is a sudden, uncontrolled burst of abnormal electrical activity in the brain. This abnormal firing disrupts normal brain function, leading to changes in movement, behavior, sensation, or consciousness. If a patient has 2 or more unprovoked seizures, the condition is diagnosed as epilepsy. Generalized seizures. In generalized seizures, both hemispheres of the brain are involved, and the patient usually loses consciousness. Tonic-Clonic grand mal. This is the classic seizure most people recognize. First comes the tonic phase, where muscles stiffen. Then the clonic phase, where rhythmic jerking occurs. Example: a patient suddenly collapses, stiffens, then begins jerking for 1 to 2 minutes. Absent seizure, petit mal. Common in children. The child suddenly stares blankly, stops responding for a few seconds, then resumes activity, often unnoticed. Myoclonic seizure. Very brief, shock-like jerks of muscles, usually without loss of consciousness. Atonic seizure. Sudden loss of muscle tone, causing the patient to collapse, also called drop attacks. Partial focal seizures. Focal seizures start in one specific area of the brain. Simple focal seizure. The patient remains fully aware, but may have twitching, tingling, or visual changes. Complex focal seizure. Awareness is impaired. Patients may perform automatic behaviors, like lip smacking or picking at clothes. Prodromal phase. Early warning signs hours to days before, mood changes, anxiety, irritability, aura. Immediate warning seconds to minutes before seizure, odd smells, flashing lights, déjà vu, ictus. The actual seizure itself usually lasts 1 to 3 minutes. Postictal phase. Recovery period, confusion, headache, fatigue, or sleep. Risk factors. Seizures can occur due to many conditions. Examples: fever, especially in children. CNS infections like meningitis. Electrolyte imbalance, hyponatremia, hypoglycemia. Alcohol withdrawal. Brain tumors. Stroke or traumatic brain injury. Triggers. Triggers don't cause epilepsy, but they provoke seizures in susceptible people. Examples: stress, sleep deprivation, flashing lights, hormonal changes, infection, alcohol or drug use. During a seizure, nursing priority is safety and airway protection. Turn patient to side. Maintain airway. Do not restrain. Do not place anything in mouth. Time the seizure. If a seizure lasts more than 5 minutes, this is status epilepticus, a medical emergency. After a seizure, assess neurological status, vital signs, and level of consciousness. Diagnostics and treatment. Diagnostics. EEG is used to identify seizure type and origin. Medications. Anticonvulsants like levetiracetam, Keppra, or phenytoin prevent seizures. Benzodiazepines like lorazepam Ativan are first line for status epilepticus. Monitor for respiratory depression. Procedures. For drug-resistant seizures, options include vagus nerve stimulation or surgical intervention. Understanding seizures is critical for patient safety and exam success. If you found this helpful, like, share, and subscribe for more NCLEX-focused nursing content.